Hey everyone, Dr. Shaikh here from the Dentalist. In the last video, we talked about soft liners, and today we're going to do chapter 15, which is artificial teeth. Before we dive in, if you're struggling with dental materials and want complete personalized help, I'm currently offering a one-on-one coaching program for a few students only. Just click the link in the description below to sign up. All right, let's get started. So first of all, we need to understand what are artificial teeth. Artificial teeth are prefabricated teeth used in complete and partial dentures. They must restore both function and aesthetics. They come in different shapes, sizes, and materials to suit various clinical needs. Now let's talk about the basic requirements of artificial teeth first. So the artificial teeth must be aesthetically pleasing. They should be dimensionally stable. They should bond well to the denture base. They should be able to withstand the chewing forces and maintain color stability. They should be biocompatible with oral tissues as well. Now, let's talk about the materials used for artificial teeth. So mainly there's acrylic resin teeth that are most commonly used. They're made from cross-linked polymethyl methacrylate and they bond chemically with acrylic denture base. The advantages are they're easy to adjust, they chemically bond to the denture base, they produce less wear on opposing natural teeth. The disadvantages are that they have less wear resistance than porcelain. They're prone to staining over time. So as I just mentioned, the other type of artificial teeth are porcelain teeth. They're made from feldspathic porcelain. They were used more in the past, but now they're less common. The advantages of porcelain teeth are superior aesthetics, they're highly wear resistant, and they're very color stable. Disadvantages are that they're brittle and prone to fracture. They're abrasive to opposing teeth. They do not chemically bond to denture base and require mechanical retention with pins or diatorics. Then there's another type, which is composite teeth. This is basically a newer development made from composite resins, but often used in implant-supported dentures. The advantages are that they have better wear resistance than acrylic, less brittle than porcelain. The disadvantages are that they are still not as aesthetic as porcelain. The bonding varies based on the material as well. Now let's talk about the occlusal forms now. So the posterior teeth has certain occlusal forms. The occlusal anatomy of artificial teeth basically plays a big role in function and patient comfort, as you might have guessed. The types of occlusal forms include anatomic teeth that have cuspal inclines that mimic the natural teeth, approximately 30 degrees. They're good for patients with good neuromuscular control. Then there are semi-anatomic teeth. They have shallower cusps around 10 to 20 degrees of angle, so a balance between function and ease of adjustment. Then there's non-anatomic flat plain teeth. There's no cuspal inclines in these ones. They're basically used for patients with poor neuromuscular control or in class 2 or class 3 jaw relationships. A clinical tip that I would like to give you here is that the choice of occlusal form basically affects the stability, patient comfort, and chewing efficiency. Here's a quick table that would help you recap everything that you need to know about the artificial teeth. Now here's your favorite part. Let's talk about the common exam questions. So the first question that comes in my mind is which type of artificial tooth chemically bonds with the denture base? The answer is acrylic resin. Then there could be a question, which teeth are most wear resistant? Which artificial teeth are most wear resistant? That's porcelain teeth. And there's one more. Why are non-anatomic teeth used in some patients? Well, non-anatomic teeth are used for patients with compromised neuromuscular control. So to summarize, artificial teeth come in acrylic, porcelain, and composite forms. Material choice would depend on the patient factors and prosthetic design as well. Remember that we need to always balance strength, aesthetics, and functional needs of the patient. And yes, my friends, if you need help with topics like this, I'm offering one-on-one coaching for dental materials for now, where we break everything down with examples, mock questions, and live discussions. Click the link in the description to sign up and get more details. You can also book a free call to ask your questions and see if coaching is right for you. And if you want early access to notes, live questions, and bonus resources, make sure you join the Dentalist Gold email list, also linked below. Please like this video if it helped you and subscribe to the channel so you don't miss any of the videos. And all the links and everything else is in the description, so make sure you check that out. See you in the next one. Take care till we meet again.